Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Christina earlier this week talked with the Pennsylvania Homecare Association about their continued financial struggles, even as a lot of government agencies and programs and, parallel organizations have found financial relief. And so tell us more about what they're facing and what they hope will happen next year.
Sure. So the home care industry is in a unique position because the state has issued two separate reports in the past year addressing the inequities in the system and the problems where there are like major shortfalls in their funding. But all they saw in the budget this year was a $21 million investment in specifically self-directed care. So that actually only impacts about 6% of workers in the home care industry, leaving a huge number who are still making between, most of them on average, around $13, $14 an hour. That's because the Medicaid reimbursement rate for home care is at the level that it's at $17 and some cents an hour. That goes first to the agencies that most people work for. Again, that's 94% of the people in the home care industry work for an agency. There's taxes, benefits, all those things that come off the top of a paycheck, and people are ending up making about $13 an hour. So it's a really low wages, and it's very hard for the industry to compete with things like retail. I mean, Sheetz, Wawa, those places pay up to like $20 an hour for people to do work that is arguably easier or at least less emotionally taxing than, directly providing care to disabled and elderly people. They're having a really tough time keeping people in the industry.
We've been talking about this a lot in a lot of different capacities as far as healthcare goes. I think it's important to note because home care, I think, is something that is further down the list of what people think of when they think of a healthcare crisis, right? But you have to look at it in the context of Pennsylvania and the way that 2/3 of our population lives in two-thirds of our county are very rural. And so the people who live there are very far from, medical facilities and often aging. Obviously we have a demographic crisis going on. And in a lot of these regions, young people are fleeing because there's no work. There's nothing there for them. So you're talking, the people who are the least paid are the ones who are in some ways the most necessary because they're going out and making contact with these people and helping them to age in place and in many ways keep them alive. So what is being asked for here is it has to be thought of in that context. It's not just bureaucracy. It's not just people sitting behind a desk. These are people out and about, really. Like you said, it's emotionally taxing. It can be very physically taxing. I think it's probably expensive having to drive all over the place. I mean, these places in Pennsylvania are far apart and houses can be few between. So it's draining and expensive in a lot of ways that, say, working at Chipotle is not. So given all of that context and that background, what does the Home Care Association, what is their bare minimum they say needs to happen in order to make this tenable?
So in the one study done by the Bureau administration, they said that Medicaid rates need to be increased by 23% to actually come up to par with where things should be. And the home care industry, or at least representatives from the Pennsylvania Homecare Association, so they know that it's not necessarily realistic to get that 23%, certainly not in a single year's budget, but they are demanding in as far as they can demand of the legislature. I mean, we saw a lot of demands go unmet this past budget season, but they are asking for at least 13% of an increase in order to start to stabilize wages for people in the industry. They're also saying that there needs to be $800 million invested in, that's a big ask. So when we're looking at the budget, the biggest things that the state spends on are the Department of Human Services and Education, and Department of Human Services is what oversees and pays out Medicaid, which is what a lot of people who are using home care are using it through, or they either have Medicaid or a Medicaid supplement. On top of that, though, the calculations that they're asking people to make is how much more expensive it is when people have to live in institutions because they can't get that care at home. So in Pennsylvania, to live in a nursing home, you're looking at about $10,000 a month, which most people's retirement funds can't sustain. Their families can't afford it. If you have a child in that position, that's a lifetime of paying that much to have them institutionalized, versus, especially in a case where someone doesn't live alone, it's not 24/7 care that's needed. They may, if you have a child who's perhaps on a ventilator and in a wheelchair, then you may need care during work hours, but as a parent, you might be able to take care of your child just fine on your own in the evening, overnight. So there's varying levels of care that people need, but in almost every situation, it is cheaper for the state to provide home care than it was when our default was to institutionalize people.
All right. Well, we'll keep an eye on this, especially as the very next budget season is quickly approaching in February, when we expect Governor Shapiro to make his fourth budget proposal ahead of what is going to be a very interesting election season for him. So, Christina, I know you will stay on this, and to follow that and more, go to thecentersquare.com/Pennsylvania.